Hello, everybody. Welcome to Chapter 7 Managing Stress, Time, and Problem. In this chapter, we are discussing about the strategies of managing stress, how to manage the time, and how to solve the different problems in the workplace situation. Let's begin the discussion from stress itself. What is stress? Stress is defined as emotional, behavioral, or physical response to an event or situation. When somebody has a stress, it is the emotional expression of certain unpleasant feelings. And when people have the stress, there is a changes in the behavior. And at physical level, at physiological level and physical level, there are different hormonal changes in the body, and it is the physical response to an event or situation when the body tries to cope with the situation by responding it. Stress is a normal part of life. Everybody has a stress, but the only difference is what type of stress and how deep is the stress level. The event or situation that causes stress is called stressor. There is an stressor. The stressor is the main cause, the causative factor of any kind of stress. So, rather than managing the stress, if we try to figure out what is the root cause of that stress or what is actually the stressor, if we try to figure out and if we try to avoid the kind of stressor, it is very easy for us to manage the stress itself. Rather than going to the level of stress, we can manage the stressor, which is the main cause of stress. New situations or illness can cause stress. We are discussing about the client situation here. New situation or illness. What is the new situation? For example, when a client is diagnosed with different health issues and the client is hospitalized and the client feels all these scenario as a new situation or the illness that can cause stress. Some stresses can be good. These are the stresses for us. How to pass this course with the good marks, that can be a good stress for us. It is called eustress. When a good type of stress is called eustress, it can make you work more effectively to accomplish the task. For example, you may have a stress about how to pass this course and how to get the certificate to work as a PSW in the different healthcare setting. That stress is logical, that stress is good because it makes us more enthusiastic, more curious to know, more idea. It helps us to make different schedule in which we can read in the school, at home, and other places. Acute and chronic stress. These are two other type of stress, acute and chronic stress. Acute stress is a temporary type of stress. It comes and goes away within short period of time. But when we discuss about the chronic stress, this is more difficult to get rid of. Chronic stresses can lead to burnout. We feel so tired, we feel so much burnout, we are feeling so much lethargic, we are all the time we are feeling depressed because of the stress, because the coping mechanism of the stress sometimes doesn't help. It means our body, our physiology doesn't feel good or cannot cope with this stress level and we feel burnout, we feel restless, we feel fatigue, we feel very much tired. It is a state of physical, emotional, and mental exhaustion. We are mentally very much tired. We are emotionally detached. Emotionally, we are feeling very bad. And physically, we are feeling so much tired. Therefore, here is a point. Stress, it has three wings. At a physical level, stress makes us very tired at physical level. Stress again goes to our emotional level, and stress, it is always giving pressure to our mental level. Therefore, stress must be managed. Stress affects the whole person, and it can have positive or negative effects on all the dimensions of life. Stress can definitely affect everybody, but it can have sometime positive effects, or sometime it can lead us to the negativity. It has a negative effect on all dimensions of life: professional life, personal life, family life, conjugal life, which is married life, and so on. Box number 7.1, page number 104, it talks about the physical sign of stress. When somebody has stress, what are the physical sign and symptom of stress? Let's go there. It's a page number 104. The box 7.1 says when person has a uh, physical stress, when person has a stress all a lot, it shows the following sign and symptom. The first one could be rapid pulse. It means the heart rate is increased. Pulse is related with your heart rate. Another name for the pulse is heart rate. Increased heart rate. Rapid respiration means breathing becomes rapid. Increased blood pressure. Rapid speech, higher pitched voice. People, they cannot maintain the cool and calm tone of voice. It means the voice goes higher pitched. A lump in the throat. They, they feel that when people have a severe stress level or very high level of stress, they feel that they are choking with something with their throat. Butterflies in the stomach. See, there is a the GI system, gastrointestinal system is also affected, and it is the physical level. That's why we are reading this under the physical sign of stress. It's a GI system. Butterflies in the stomach. Something is moving in the stomach. It feels like that. Dry mouth, sweaty palms. The palms of the hands are full of sweat, and sore muscle in the neck. There is a muscle pain. Sore muscle in the neck means muscle pain in the neck, arms and back. Perspiration, that is a sweating. Another name for the sweating is perspiration. Nausea, diarrhea, urinary frequency. There is a bladder irritation because of the stress. Because stress goes to the central nerve system, and bladder is controlled by the central nerve system. There is a urinary frequency. People with a high level of stress, they want to go to the washroom frequently. Urinary urgency. They feel like they want to void, but they cannot because urine is not formed as the stress level goes up. Difficulty sleeping. Obviously, people have a difficulty sleeping. Change in the appetite. It means people they can't express any desire to eat like their regular meals, breakfast, snacks, or lunch, dinner, etc. Change in the weight because of the stress. It sometimes stress can cause weight loss, and most of the time stress is one of the main reason of weight gain. Stress people, they are gaining weight a lot. So this is how the stress is changing our physical level, and these are the sign and symptom of physical level. See our lungs, our heart, our GI system, which is gastrointestinal system, our bladder and bowel movement, and every movement is affected when we have a very, very high level of stress. Now let's talk about what are the actual root cause of those stresses, the source of stresses. Changes. What do you mean by changes? Changes in financial status, changes in physical level, changes in health, people diagnosed with different diseases, people have to leave the house and they have to live in the long-term care homes. There are so many changes at different dimensions in life. That's why any changes that can be the source of stress, or any changes that can be triggering the stress. Emotional pleasure, when people have extremely happy or sad, or let's say it's a pleasure here, and let's um, confine our discussion with the happiness. When people have people are very happy, like they got the lottery, something like that, their body is full of stress. They cannot cope with the certain emotional blast in the body. Lack of control, when people have stress, they they fail to coordinate in terms of their physiology and emotion. Lack of control at physiology, sometimes they have a they there is a leakage of urine or feces. It is a physical level. And sometimes they have a high pitch of sound, that is the emotional level. And there is a conflict within. When there is a stress, conflict within, when people have some indecisive mood, and those indecisive mood, it means when somebody has a difficulty in making decision, they are in the conflicting position. It's a self conflict within. And sometimes people have a conflict with other people, like co-workers. Where we work, we may have a conflict with other people. That conflict even increases more stress. That's why we have to know how to resolve those conflicts, how to manage those stress, and how to manage those conflicts at the same time. In the school is one of the main reason of stress, because school, when we say school, so many things come together. The first thing it the first thing is the finance, the huge amount of money we have to spend whatever school we go or whatever course we read. That is financially we may have stress. Another is we have to spend maximum time on study. We have to go to school, we have to return from there. There is a stress on the way to go to school or returning home from school. We have to manage the kids. Like go telling school could be easier, but in reality, managing school life, family life, professional life, it is very difficult. That's the main source of stress. And daily frustration, people have a daily frustration because of the workload. People may have a different work or different responsibilities to fulfill in a day, from early morning to the late evening. That makes them burn out, that makes them so much tired, and they feel the stress both at a physical level and emotional level. So these are basically the main cause, the root cause of stress. And the point here is, if we can manage those root cause of stress, the sources of stress, we don't have to experience those stresses. And the better ways to manage the stress is to early finding the source of stress and addressing them promptly. As soon as we know the source of stress, let us address the source of stress first, and then we will have a less interest and we will have a happy, active life. Response to stress. How we respond to stress. A person's response to stressor is influenced by several factors. A person, whether the person is successfully managing the stress or stressor or not, depends on what is the condition of the person, what are the factors playing role behind those stressor. One is gender. What do you mean by stress and gender? Who may have more stress, male or female? Definitely, for me, female members have more stress. They have more responsibility. They have to make money. They are not only the homemaker, they are professional, they are a student, they are mother, they are wife, they are sister, or they have to look after so many things. Actually, they are handling so many domestic responsibility, which can be one of the main cause of stress. Perception. Perception is the way of looking at something. That may be one stressor. Availability of the social support. When there is a stress level going high and high, what is the social support system is there? Is there any counseling for the people who are having those high level of stress? Is there other social, other friends and family members supporting for the person who is having that level of stress or not? It also depends on that. And cognitive awareness. Cognitive means intellectual level, education level. A higher the education, more knowledge to manage the stress. If people are well educated, they understand the stressor. They try to address the stressor, and they are having the less stress in life. They are managing their time, they are managing their work, they are scheduling their work and rescheduling their work, so they want to have less and less stress. That's why cognitive awareness means their mental ability, intellectual ability, or let's say intellectual capabilities. Health of a person determines so many things. If a person is healthy person can manage stress more um, easily. Personality. What is the personality? This is a personal trait of a person. If a person is open minded, if the person can seek help from his friends and family, the person can easily get rid of those stress and stressors. Past experience with the same or similar stressor. When a person has a past experience of those type of stress or stressor, the person has already habituated with those stressor and stressful situation. Person can easily manage it because the person has the already experienced those situation. Number of other stressors. Nature. Severity means seriousness. How serious is the stress? If the stress is really uh, very high, the person feels burnout, the person is very passive, the person goes depressive, and so many things happen. Duration of the stressors. If the longer the stressor remains in the person's life, the more bad experience of stress will be there. So shorter the stressor lives there, the shorter the stress will be there. So the idea is the more stressor, the longer stressor we have, the longer period of time we will be definitely having those stressors. So the best idea could be how to address those stressors and minimize the stress. Box number 7.3, it says emotional and behavioral sign of stress. What are the emotional and behavioral sign of the stress? Let's go to page number 105 and discuss about what is the emotional and behavioral sign of stress. It means when somebody has a stress, like we read already the physical sign and symptom of stress, like what emotional and behavioral changes the stress can bring in person's life. Okay, so let's go to box number 7.3. 7.3, it says, when in the emotional and behavioral level, the person has high level of anxiety. The person feels very much sad. There is anxiety all the day. The person goes depression. The person has a feeling of being depressed. Anger, the person is showing the behavior. Anger, frustration, worrying, person is worrying a lot more. And fear, there is a kind of fear. Burnout, that's a tiredness. Burnout, the person is so much weak and emotionally distressed. And irritability, there is no calm and quiet environment, person feels irritation, that's called irritability. Loss of self-esteem, self-esteem means, the simple word we can say, self-confidence. And self, the like person's own image, looking at person's own life, own image, own level of confidence. When person has a loss of self-esteem, person feels very low, person feels humiliated, persons feel weak, persons feel deprived of the help from other friends and family. That's all about the self-esteem. Fatigue, that means tiredness, person is very tired. Dissatisfaction, another point is dissatisfaction. Dissatisfaction, person is not satisfied, that's why the peace and harmony in life they are away from him or her. And forgetfulness, person starts forgetting the recent memories. Poor concentration, when people have a high level of stress, people cannot focus on concentration, they are losing the concentration, they are going here and there in their mental thought process, difficulty focusing or following the direction. Even people cannot focus on one particular area, and even they forget to follow the direction. Emotional outbursts, including yelling or crying. These are the outbursts. These are the burst of the emotion, which are uh, yelling or crying. They come up as yelling and crying. Smoking, that's a negative coping mechanism with the stress. People say, I'm smoking because I feel so much burnout today. I'm stressed today. My stress level has gone very high today, and start drinking. That's the beginning point of all alcoholic people. They feel stress, starts drinking, and chronically they start drinking all the time, and they becomes like alcoholic. Talking about the stressor, when people have the stress, let's not talk about the stressor itself. We can help the person by telling something different idea that helps them to minimize the stress, and that helps them to go away from those stress. These are the non-pharmacological intervention for the stress people. If we are working as a support worker, and if our client is full of stress, we can play music, we can talk about something good idea, that person's role, positive role of the person when he was or she was in the young life and the professional life. If if the person is given the newer idea, introduce a newer idea sometime, telling a story and reciting poems or playing music, it could help to manage the stress to some extent. And there is a defense mechanism of the stress, that is a physiological defense mechanism. And let's see how person can uh, survive with the defense mechanism. It's an unconscious reaction that blocks unpleasant or threatening feelings. It's an unconscious reaction that blocks unpleasant and something threatening feelings. If a person has a good defense mechanism and the person has a stress, the person can easily manage those stress and stressors. Most people occasionally use defense mechanism because this can help to relieve stress. And most people who are cognitively sound, who are intellectually good, who are well educated, sometimes these people use the defense mechanism because this defense mechanism can help to relieve the stress, to solve the stress situation, and they come up with the solution and their stress level goes away. Understanding defense mechanism gives you insight. Insight means the idea, the knowledge, the sequence into what your clients may really be feeling. So basically, as a personal support worker, we are here all our discussion of the stress and stressor defense mechanism, physiological, emotional, and all level of stress and stressor. We are connecting these with our clients. So understanding the defense mechanism as a support worker, we can help our client to minimize their stress level. So, the first point could be validation. How to do validation? Let's talk about validation. Validation means recognizing uh, their own stress level, recognizing that, and providing compassionate care. Validation means to acknowledge, recognize, or confirm the client's feelings. This is how we can validate. When our client is feeling so much stress, we have to recognize, we have to acknowledge, we have to let them feel that we are sharing their idea. When people can share their stress to other people, they feel lighter. This is how we can validate. Managing stress in your life. In your life, if you, as a personal support worker, you are full of stress and you go to work with a stressful experience, what kind of care you could give? You will forget. You will burn out. You will have a fight. You will be yelling at somebody and you will be crying because these are the coping mechanism and these are the emotional symptom of stressed people. Don't ignore sign of the stress. If people have stress, don't ignore it. Try to manage it. Try to use it with the coping mechanism. How to cope with, try to validate. This can result in illness. See, if people have stress, including you or me or our clients or whoever we know, our friends and family, if people have stress, we cannot ignore it. We have to manage it. This is called stress management, managing the stress. And there are so many ways. There are the strategy. Means these are the ways of managing the stress. Develop self-awareness. Know yourself. Try to know yourself. Before you knowing other, try to know yourself. Develop self-awareness. If you develop the self-awareness, you know you better, you know the situation better, and try to rationalize. Try to try to use your coping mechanism with this, and you will feel better. Take care of your needs. When you are in need of something, you have to take care of your needs. Think positively. Positivity, optimism are very greatest mechanism to tackle those stress levels. When we think positively, we have different hormonal changes in the body. When we have very much stress experience, we have again different hormonal negative. The hormones function in a negative way in our body. That's why the best way could be think positively. Be assertive. Be assertive means think positively. Make decisions that work for you. Do not make the decision in a hurry and regret for a long period of time. Try to make the decision by collecting the evidences, by using your past experiences, which is suitable for you. That type of decision helps you a lot. Ask others for help and support. This is another way of stress management. Always ask for help. For example, you are working in a floor in a long-term care home and it is your first day of your work. You do not know how to begin the work and you are just standing at one corner and seeing at people's face and people do not like it. Because you are there as a professional, you have to start the work, but you do not know how to begin it. There is a nurse, there is a co-worker, another PSW. Just take 1 minute and speak very politely and take for help. And the person is helping you readily. Practice calming exercise. What are the calming exercise? Take some long breath. Take some long breath and think positively. Because of taking long breath, your mind gets more oxygen. Oxygenated blood means the blood, fresh blood, the blood that has more oxygen mixed with. And because of the high level of oxygen in the brain, you can start thinking nicely. This is the benefit of taking long and deep breath when we are in the stress level. We are experiencing high level of stress. Learn to accept the things you cannot change. Remember, we have so many limitations in our life, in personal life and professional life. We have to know what is our limitation. If something goes very bad, it's not your fault. So try to accept the things which you cannot change. If you do not accept the thing and you try to change everything, you try to change the world, it will be very much a stressful situation for you. Therefore, know your scope of practice. Try to understand what is your scope. What are the things you can do, you can change? What are the things you cannot do and you cannot change? If you know the boundary of your work, which is called scope of practice, you will have a less and less stress level. And when you are free of stress, you can think of supporting other people who are in stress. Managing stress in your life continue. Dealing with the stress is important. The the better idea is how much stress you will have depends on how nicely you deal with the stress. If you are skilled in dealing with the stress, you will have a less stress. If you cannot deal with the stress, if you do not seek help from other friends and family, co-workers, your teacher, your administrator, in the college, at home, in the workplace, stress is everywhere. So, dealing with stress with the proper mechanism is the wise idea. The stress affects you, your family, you, the care you give. If you are stressful, there is no possibility of getting compassionate care, safe care, quality care by the client. If you are stressful, you cannot give it. Therefore, managing your stress is more important before you go to manage somebody else's stress. Your client's quality of life will be compromised. When you are burned out with the stress, when you are full of stress, you are physically, emotionally, and you are socially, you are full of distress, stressful life, and you cannot give a quality care, you cannot give a compassionate care, and the client's quality of life will be impaired because of your inability to cope with the stress. Therefore, you must learn how to cope with the stress, how to manage the stress. Then only we can expect you can give quality care to your clients. How you relate to co-workers. Here, if you have a stress, you try to share certain level of stress to your coworker who can help you. There is a nurse in everywhere you work, and the nurse is more knowledgeable, more skilled, and they are always there to help us. We have to be very open minded. We dare to ask help. That's why they are always ready to help us, because after all, we are working as a team, and a team member is very significant. Our role as a support worker in a healthcare team is very important. We are being helped by everybody: co-workers, the nurses, the manager, the administrators, everywhere, everybody. Job burnout. That's the difficult situation you are, difficult experience, a very bad experience you are having with the job. Burnout is a common among the healthcare worker. This is a high level of stress. It is called burnout. Very, very high, unmanageable level of stress. Because of the workload, because of the heavy work you have to provide the care with those clients, the greater number of the clients you have to provide care. These are the root cause of the burnout. Burnout can have a negative consequences for your health. As a healthcare worker, these are the negative consequences. Burnout, it means the high level of stress. It's unmanaged stress. It can have a negative consequences in our health, in your health, in my health. Do not ignore the sign. If you find certain physical sign of stress, mental sign of stress, try to address it in time. Long-term effect can lead to physical, emotional, and mental exhaustion. Physical and mental and emotional level, we may be feeling certain level of harm because of our negligence. So even if we see a couple of sign of any level of burnout, high level of stress, try to resolve it. Sign of burnout. Let's talk about what are the sign of high level of stress, which is burnout. You find yourself more critical and sarcastic. See, sarcastic. You are using the language for a different purpose. Sarcastic, which is sarcasm. You find yourself more critical and sarcastic. You are telling something in a very sharp tone. You are not telling you are not telling something in a normal tone. You are being very critical, doubtful, confused. Sleep habits have changed. Because of those burnout situation, people's sleep pattern during the night changes. People have a lot of sleepy mood during the day when their sleep disturbance at night. And our job is impaired. We feel sleepy. Daytime sleepiness definitely impairs our quality care to the client. Appetite has changed. No mood of eating anything today, tonight, this time, my lunch. You refuse eating anything. That's the physical sign. Appetite has been changed. You feel tiredness all the time. This is called fatigue. You drag yourself to work. You are very, very lethargic. You are going to work just because you want to continue the job. You are not thinking about providing quality care because of the burnout situation you are experiencing. Trouble getting your day started. When you begin your shift work, you are still having the trouble there. That's why it's 7 or 8 hours, sometimes 12-hour shift. You cannot finish. It's a whole year. You feel like it's a whole year, whole months. Less patience with the client and co-worker. You may be yelling at somebody with the client or the co-worker. Even if you have a small issue there, you try to make it bigger and try to yell at somebody, or you feel so much humiliated and you start crying. Self-medicating. See what do you mean by self medicating? You have to take the medication yourself. It's a self medication. You have to take foods. You have to eat in time. You have to take the prescribed drugs by the doctor, or alcohol to make yourself feel better. Or alcohol, do you think you drink alcohol to feel yourself better? Never. This alcohol is a negative coping mechanism. Smoking is negative coping mechanism. Do not follow any negative coping mechanism. Time management. If you manage your time very nicely, you organize yourself, you prepare everything before you start your job, it is very easier for you. You will have a less and less stress. The time management and stress management, they go together side by side. Time management is essential to reducing the stress. See, time management is very significant to reduce the stress level. Once you manage the time, you know when to do, what to do, how to do, whom to do. Then you know. When you know all the 5 W's, then 5W1H, you know everything. This is how you can minimize the stress level. You must identify and manage your priorities. This is called setting priorities. It's also called prioritizing the work. If you prioritize the work, if you arrange the work in terms of the first most urgent and then urgent and the regular. In that way, if you arrange the work, you will manage your stress level because time management is very significant. At work, your priority is to provide competent, compassionate care. You have to provide competent. What makes you competent? If you are knowledgeable, if you know what you are going to do, you are called competent. If you know how to give partial bed bath, if you know how to make the bed properly, if you know how to transfer the client from the wheelchair to the bed or bed to the wheelchair, if you know how to work in the kitchen, if you know how to assist the client in dining room, you are competent. If you do not know all these activities, you are not competent. And when you are not competent, that is the main stressor of your stress. And compassionate care. Compassionate care is the care, high quality care with the safety, following the safety measure. That compassionate care is all about the care the client wants. Outside of work, ask yourself, when you go to break or when you are at home, ask yourself, what do I value most in life? What do you value most in life? It is the honesty at work. A support worker value client safety, personal safety, family safety, how you do your proper hand washing and hand sanitizing to prevent yourself from the bacteria and virus, to prevent your families from the bacteria and virus, and to prevent your clients from the bacteria and virus. So if you know, if you what you value, the most valuable thing in life is life itself. You value your life, your family's life, and the client's life. What gives me satisfaction? Try to figure out what gives you satisfaction and try to get that satisfaction. What principle do I want to live with my life by? There are certain principle, philosophy of life. One philosophy of life is serving to human being is serving to God. It's the philosophy of life in nursing because we have to provide service to the people, and all human beings, they are part of God's creation, and indirectly or directly we are serving the God. So service to humanity is the best service in person's life. This is how I think or you think. Setting smart goals. This smart is an abbreviation of certain newer words. What makes something smart? If it is a specific time frame, you have the time management and you are using the specific time frame, you are the beginning of smart. And measurable. Anything you do can be measured. It can be measured by, in terms of the time, in terms of the quality, in terms of the number, in terms of the quality or quantity. It can be measurable and it should be achievable. You have to achieve when something you plan, any goals, you have to achieve the goal. Whether you have achieved the goal or not depends on how you set your goals. You have to set the goal being an smart. And smart is specific, measurable, achievable, realistic. Your goal should be realistic and timely. You have to follow the work in timely manner. What do you mean by realistic? Be very precise and realistic in your goal. Do not um, do not try to fly in the sky like a bird. That's not realistic. Realistic is, in a certain period of time, I want to set this goal. For example, I want to give you a nice example here, setting the goal. So during my shift, I will prevent I will prevent the bed sore of a client by repositioning the client every 2 hours. That's the smart goal. And when you work, you always reposition the client every 2 hours, reposition the patients in the hospital every 2 hours, clients at home every 2 hours, resident in the long-term care or nursing home every 2 hours. Then you are preventing the skin breakdown, and you are preventing the skin sore. You are preventing the pressure ulcer, and you are achieving that goal. So when you make the goal, your goal must be specific. It should be measurable, because all pressure ulcer are measurable. Stage 1, stage 2, stage 3, and unstageable. There are 4 stages of the pressure ulcer. Achievable. Definitely you can achieve. If you pay attention, you can achieve the goal. Realistic. Preventing a client from bed sore, it is one of the most realistic goal you have set. And timely, it's every 2 hours. Repositioning the client every 2 hours, that's a timely manner you have to follow. This is how you can achieve the goal. Planning your life and your work. Everybody has a personal life and everybody has a professional life. Good people are good people because they are good manager of their time. In the personal life means at home and in the workplace. Question to guide your decision include: what are the client's need and priorities? It is where do you find the client's need and priorities? Can anybody tell me? Yes, this is a care plan. Or another name for the care plan is called nursing care plan. The nurses, they make the client's care. This is a roadmap of the client's care. The procedures, everything from your beginning of your shift to the last of your shift, you have to see everybody's care, client care. This is called client care or the nursing care plan or care plan. How much time will each task or activity require? So you have to manage the time. So for that task, how long that task could need time? Like feeding one client, what is the maximum time you can spend? It's half an hour. It is usually in the long-term care, half an hour is a usual time. It may not be maximum or may not be that less. When will I do each task and activity? See, you have to manage your each task and activity in a timely manner. So you can make a plan like that. Can I organize my time so that some of the tasks overlap? Definitely, you can organize your task. For example, before you go to the client for the morning care, I'm giving you very specific example. This example will benefit you throughout your professional life because this is my first hand experience as a PSW worker as well when I was doing that job. So when before you go to the client, figure out, see the care plan. You have to do the morning care. You just manage everything. You manage the thing for the oral care, for partial bed bath or total bath, or you can change the briefs or pull ups, all things together, and you can take the bed linens on the day of bathing the client. You have to change the whole blankets or bed linens and everything. So if you take everything together, you don't have to come and go outside and inside, and that feels the client very much irritated. That's how you can, once you are inside the client's room, you just close the curtain. That's the privacy you are maintaining. Ask the client that you are doing this thing to that. Take the consent, means take the permission from the client and start your job. This is how you are saving your time. You are saving, you are managing your time, and you are managing your stress level at the same time. Again, you ask another question yourself. Have I allowed time for the unexpected? Remember, unexpected things happen unexpectedly. It's not in our control. And manage some time for the unexpected happen. So don't leave your job to the last point. Try to figure out the job, try to finish the job in time within the expected schedule of the time, and manage some time for the unexpected. Another question you can ask yourself is there anyone with whom I should coordinate these activities? Of course, there are always the nurses or your co-worker. You can coordinate your activities. You can make a plan with them, and you can seek help. You can ask for help and be ready to help other as well. Give each task a time limit. Remember, it's a time bound. Everything is time bound. You are, from the very beginning of your shift to the last time of your documentation you finish, you are time bound, and beyond the time limitation, you cannot stay there, you cannot do anything. Decision making. Decisions are made by using the logical, in a logical way, by using the knowledge. Do not make any decision in a hurry. Skills that you need to make a decision. Focus. First, focus. What kind of decision you are making? Focus on the client and the task to make the right decision. Your focus in the workplace is just focus on the client. Never use your cell phone and try to deviate yourself from the work. Always focus on the client and the task. You are task oriented, you are goal oriented, and that's how you can make the right decision. Flexibility. You have to be a flexible worker. Every healthcare worker, they must be flexible. You need to be flexible and responsive to your client's need. you are you are bringing a cup of coffee to your client, but the client says, oh, I need some water. Just go and bring the water. This is how we have to be flexible. Do not start arguing. Oh, you said me coffee, again you said me water. This makes you very rude and unprofessional. So be very flexible, as you can. Decisiveness. This is a way of making decision. Stick to your decision unless they are not working. If your decision is working, it is a functional, it is good for the client's better health outcome, you can stick with your decision until they are unless they are not working. If the decision is not working well, and you will be Sometimes indecisive means you are in the state of not being able to make the decision. Your indecisiveness, your inability to make the decision can upset client because you are demonstrating on skill there. Your lack of proper decision at proper time can impair person's health. For example, your client is having difficulty breathing and you do not go to the nurse and tell the nurse that your client is having difficulty breathing. This is your indecisiveness. This is also called a kind of neglect. This is also called a kind of your incapacity of the work. So you have to be promptly reporting the changes and you have to be making quickly decision to go and ask the nurse about report the nurse about the changes in the client situation. This is how we have to be very careful in making decision. So focus on the work, be flexible, be decisive, stick with your decision when they are good, and don't be indecisive. Just ask help, take help from the friend, and do not make the client feel upset. Decision making in different healthcare setting, problem solving. You have to solve different problem with the coworker. Do not fight with the coworker. Identify the problem. Try to find the root cause of the problem and analyze the problem. What you did to solve the problem and what is your role? What is the another person's role? Could be there. Analyze the problem and find the solution. This is the best way to solve the problem. Find the solution. Devise a plan. Just make a plan and work for that. Deal with the conflict as necessary. Remember, conflict is everywhere. People may have a conflict, but there should be personal opinion in the conflict. But do not have a conflict in providing compassionate care to the client. If you have a conflict in assisting the client, that's very gross and it is very highly unprofessional way of involving in something unnecessary ideas. So you may have your own opinion, but your conflict must not impair quality care. Your conflict must not be um, resulting in compromising quality care, compassionate care of your client. Box number 7.7, managing the conflict. Let's go there. 7.7, how to manage the conflict. How you manage the conflict when if you have a conflict. So box number 7.7 says it talks about the different managing strategy of the conflict. You know what is the root cause of the conflict. Try to talk to another person who is the part of the conflict in a very professional way, using very soft tone of voice. Manage a meeting time. Try to figure out your role and try to share what that person could have the role, what is the person's opinion for that, and you can give different opinion of that and try to remind the person because of the workers conflict, the client care should not be affected and it should not be compromised, and try to schedule a date and time to review the situation, identify the ways to resolve the problem, offer your own thoughts and ask for the other person's idea as well. Listen to the person's response. Do not interrupt when the person is telling the idea. Explain the problem and what is bothering you. Give the facts and describe the specific behavior. Focus on the problem, not on the person. For example, say, I need to know when you cannot help me so that I can make other plans. Avoid criticizing the person. For example, saying, you are always late and never call to let me know. Do not speak in a blaming way, and these are the better ways of solving the problem, and you can resolve the problem and you can manage the conflict. Respect diversity. We work in Canada, we work in Toronto, we work in Ontario. No matter where we go in Canada, we have to respect the diversity. Diversity means like a beautiful flower having multicolor flowers, flower and flower plants. Our population is also like that, having different background. This is a country of immigrants, and so many immigrants are here, and native people are here, mainstream Canadian are also here. Like we see so many faces of so many background. This is the diversity, and we learn to respect the diversity. We learn to appreciate other. We learn to follow our own culture, and we learn to appreciate others culture. That is called culturally competent care to our clients. Depending on the culture, some people may simply deny, they refuse that the problem exists. It's not. Depending on the culture, some people may deny that the problem exists. But even if they deny it, problem is there. Taking action could cause displeasure, so some people may choose not to address the conflict. When sometime people, a support worker from a different culture, may think that because of this discussion about that issue could cause displeasure to my co-workers, that's why he or she may not be talking about that issue, which is not good. Some may choose to blame others. This is a blame game. Nothing blame game in nursing field. Some may not respond verbally at all. Sometimes they are passive aggressive. They don't respond at all. They are not telling anything at front, and behind the bush they are trying to criticize other people. That's very unprofessional way of dealing the situation. Do not hesitate to seek guidance. If you do not know, do not hesitate. Just be ready to learn, to get some guidance from your supervisor or co-workers, because people may not know many things, but the problem is not knowing about it. The problem is not telling that you do not know. Try not to lie, or try not to deceive other people. Try not to force, or try not to blame other. These are the best way, and these are the honesty as a worker. Thank you for your patience listening to this chapter. I sincerely encourage you to go through the textbook and to these slides, which will help you a lot. Thank you. Have a good day.